Okay, hi everyone. We are group 3 and we are going to be talking about personal protective equipment today and some of the change in policy that surrounds that in the hospital that we've seen so far in our careers.
So, donning personal protective equipment, otherwise known as PPE, outside of a patient's room prior to entering is critical in order to protect the health and the welfare of our patients, guests, and all medical personnel that enters that room. Many students in our group have had clinical experiences on units in the hospital that store the PPE inside of the room rather than outside of the room. This requires the medical personnel and guests to enter the room before they are able to don the proper PPE, which potentially results in contaminating both the room and the medical personnel entering the room. The main idea is that PPE should be donned outside of the patient rooms right before entering, rather than donning the PPE inside of the room after entering. Our focus is implementing a change in the hospital policy that it is required to have PPE available and stored outside of all patient rooms in the hospital. This requires all individuals to properly don the PPE prior to entering a room, which will protect the patient, the guests, and the medical personnel by preventing contamination and putting any individual's health at risk.
So the change theory we chose to pick was normative re-educative. So we're going to target our social cultural norms by using infection statistics from other hospitals to show how effective proper PPE usage is. We're also going to educate our staff on new information, educating them that the CDC recommends that PPE be donned before entering the room and removed outside of the room. We're also going to target the feelings, values, and needs of our staff by conducting small groups to collaborate and assess their opinions related to the change. We're also going to use the feelings and values of our patients. So we'll look at feedback from annual Joint Commission safety reports and see how patients are rating us on our patient satisfaction based on if we're following our proper infection protocols. And our change agents will be our nurse managers and our quality safety team.
All right, we have two ways we're going to change this. Our change strategy is going to be facilitative. We chose facilitative because we know that the issue is present. All nurses know the proper way to go into the rooms. However, they're unable to because of the cabinets are inside. So for us to actually follow this change, we're going to have to change the way the structure of the facility is. We chosen the facilitative strategy as our first approach. And the way we're going to sell that strategy is using the educational strategy. We're going to use like evidence-based practice. We're going to use facts. We're going to present it to leadership, showing, hey, we need to change this to not only cut costs, but to possibly even, keep patients from getting infected. So by using these two strategies, we're going to try to change the leadership, thereby changing the way we actually can get access to our safety equipment.
So the framework that we chose was Havelock's framework for change. He took Lewin's theory and broke it down into 6 steps. So these are building a relationship, diagnosing the problem, acquiring resources, choosing the solution, gaining acceptance, and stabilization. And he chose to pay more attention to the unfreezing stage. And this is where you want the participants to become aware of their problem and aware that there is a better method. You want them to identify the need for change, and you want to establish motivation within them so that the change can occur. The current status quo that they are in needs to be identified as unacceptable by them so that the change participants can motivate their own change process. And the change agents will do this by building relationships between nursing leadership and nurses in order to disseminate the evidence. So to implement this change process, we're going to not maintain the status quo of improper PPE because that would lead to extreme financial cost due to infection. We're going to collect the necessary data and information, such as guidelines from the CDC and quality improvement reports. We're going to select and analyze the data that comes from the CDC, and we're going to send that into the quality improvement team within the hospital. And we're going to develop the plan according to the processes that we've already mentioned regarding education and the normative change theory. And we're going to identify supporters and opposers so that we can use the enthusiasm from the supporters to help sway the opposers. So continuing on in the process, we're going to build our coalition of supporters. Like I said, we're going to use that enthusiasm to sway other people. We're going to help prepare for the change. So we're going to maintain support for those who are about to experience the change and empathize with them that what has always been may not be in the best interest of their patients, and remind them that it should be about the health of the patient. We're going to prepare to handle resistance, because resistances always come with change. We're going to provide a feedback mechanism, specifically through a Google form, so that they can give the change process team some good feedback. And we're going to evaluate the effectiveness of the change through the use of the Google feedback form and direct observation of whether PPE is being utilized and stored properly.
So part of any change is barriers and resistance to change. There's always going to be those who aren't in favor or have no interest in participating, no matter what the research shows. So in the normative re-educative approach to change, these barriers will most likely occur due to the lack of willingness of nursing staff or hospital staff to break the habits that they're comfortable with. If you're used to going into a patient's room and then grabbing all the stuff to put on for your PPE, and then all of a sudden it's outside of the room, it might not be as easy as it once was. So according to Lewin's force field theory, a restraining force is a type of barrier that could prevent change if it is not outweighed by a driving force. So if the resistance force of the uncomfortable habit is not outweighed by the emphasis on patient safety and the necessity of putting on the PPE outside of the room, then there will be barriers. And the biggest restraining force on the suggested PPE change is the perception of the staff that it won't achieve the goals, or that there'll be a failure of them to see the big picture of what's going on. So managing this resistance is an essential part of taking care of barriers when implementing any sort of change, and in this case as well. And it is part of Lewin's unfreezing principle of change theory. So for this situation, some strategies could include open communication with anyone who opposes the change. If you have a nurse that is not following the PPE standards, having a conversation with her instead of just going above her head or telling on her is going to be more effective. Emphasizing positives of the change, so patients will be exposed to fewer microorganisms and will be safer if the PPE is outside of the room. That should be the big picture. That should be the emphasis in every conversation. And then redirecting resistance to more important problems. So your uncomfort with this new procedure is not quite as important as the patient safety and preventing infection. So redirecting those complaints and redirecting barriers to minimize the resistance is going to be the most important thing when it comes to the management of this new change and the theories that we're invoking to create the change. So in conclusion, we have all spent time in the hospital and in clinical this semester and have seen some nurses who do a great job performing PPE, some who don't. Most importantly, we've seen that on the units where the PPE is outside the room, there is a more of an encouragement of nurses to follow the standards of keeping a patient safe. So we think that personal protective equipment is very important, and that implementing changes like this, i.e. moving the PPE from inside of rooms to outside of rooms, can really make a difference in patient safety and infection control.